Hello everyone. Today's video is about mold illness. There's a couple of questions on this topic. As per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. So the one question is, back in college, my daughter was exposed to mold in her dorm. Now she's in her mid-20s and has rheumatoid arthritis, allergies to several foods, and just a walking autoimmune time bomb. She's even allergic to most of the medicines they try to treat her with. She was never sick a day in her life before this. Could the mold from back then have sparked her illnesses? So yeah, I'm really sorry to hear about that, and that just sounds really awful. She's obviously, it's awful for anybody, but she's still so young, and that's very, very, very sad. I hope she's feeling better soon. I've had many patients who had a mold exposure years prior to the onset of years prior to the onset of their symptoms. I've had some patients where it was decades prior. I just actually had a new patient today. They're dealing with mold issues. They're in their 40s now, and they grew up in a moldy house. There was mold exposure from the time that they were born until the time they were 18. Their parents still live in the same house, and when they go back to visit, they're like, yes, I'm definitely aware of the moldiness in the home. And so it's it's entirely possible for mold to kind of fester in a person's system. Now, it depends on your school of thought. Some clinicians believe that you're really only going to be sick if you're in a moldy environment where you're actively being exposed to mycotoxins, and then once you get out of that environment, any lingering health issues are due to the damage that was caused by those mycotoxins. And then there are those of us, and I'm in this camp, that believe that mold can colonize the sinuses when we're in a moldy environment for long enough. And so if you still feel unwell, if one still feels unwell after getting out of a moldy environment, then it could be in part because of mold that's in the sinuses that is continuing to release mycotoxins into the body. So the reason that I believe that that is true is because I've had many patients where they get out of a moldy environment and then they start a nasal spray, and then they feel dramatically better from the nasal spray. And in some cases, that's the only intervention that we're working with. In many cases, we work with lots of other things, but when a patient is only working with a single intervention and that makes them better, then it's a pretty strong case to be made that that's probably treating something that's really relevant to what they're dealing with. So that is, so long and short of it is exposure from, a few years ago, 10 years ago, 20 years ago, could potentially be a contributing factor to a disease that comes on quite a bit later on. Now that being said, rheumatoid arthritis and other autoimmune issues and food allergies can be related to other things too. So in my opinion, we have to be really careful in the complex chronic illness world to not get blinders on. So we don't want to have mold blinders, we don't want to have Lyme blinders, we don't have to have SIBO blinders. It's important to make sure that we're, as clinicians, and I think as patients in general, we want to not be myopic with things. I have some patients who come in to see me and they're like, this is what's going on. I had this test from 10 years ago. I have Lyme disease, and that's causing all my symptoms. And I take their history, and it's like, well, you've been treated for Lyme for 10 years and you're not a lick better today. And you also have significant history of mold exposure. It might have mold, and many times patients are like, okay, so sure, let's explore that, and sometimes like, no, this is Lyme, this is what I want treatment for, and it's like, that doesn't happen very often, but I think it's just important for us to not throw everything into the mold and Lyme and all the heavy metals and all the different complex chronic illness etiology baskets that are oftentimes culprits, but not always the culprits. So thank you for the question. I hope your daughter is feeling better soon, and I hope that information was useful. There's one other question also about mold. I'm just scrolling to it here. So I had posted a video, I think quite some time ago, about cholestyramine. And so it says, my gastro doctor gave me cholestyramine for mold toxicity. My question is, could this work for leaky gut issues? My moldy environment caused me to become seropositive for aggressive rheumatoid arthritis. So another RA question here, or RA related to mold thing, possibly related to mold case. So I'm trying to fix my gut while also taking Ornicia injections weekly. Do you have any knowledge of this for leaky gut? So thank you for the question. So as far as cholestyramine goes, To my understanding, it's a bile acid sequestrant. So folks primarily use it when they have issues with like kind of excessive amounts of bile being excreted into their guts. So sometimes after people have gallbladder, like a cholecystectomy, like gallbladder removal surgery, they'll have like kind of this like dumping, like this, oh my gosh, like a bile, like excessive excretion syndrome, and they're just having like, tons of diarrhea, and it's really, really not good. So cholestyramine acts as a bile acid sequestrant to bind up those bile acids that are being excreted excessively, and that can be, a miraculously useful drug. It just so happens that cholestyramine is also good at binding up mycotoxins. So doctors like Dr. Shoemaker and many of the doctors that he trained use cholestyramine as kind of this gold standard binding agent for mycotoxins. The challenges with cholestyramine is that it can be hard to access. A lot of doctors don't like to prescribe it. It's somewhat cumbersome, and they have to take it like 4 times a day, to my understanding. It doesn't taste very good. I believe it's a powder that you have to mix up and drink, and some people just don't like it and don't feel well with it. So it is a good binder. It can work really well. Does it work better than non-prescription binders like activated charcoal? Based on my experience, I've not really found that I don't believe I've had any patients where cholestyramine was like absolutely crucial to take and like other binders didn't work as well. I have had some patients where cholestyramine seemed to work better than other binders, but not like twice as good or 3 times as good, maybe like 25% better, let's say. So I don't think that for the most part, I'm sure there are exceptions to this, and if you've had experience with cholestyramine, like, nope, that was the only thing that ever worked for me, like please post it in the comment section. I'd be curious to know about that. But in general, there are other binders that seem to work very well. And then, a lot of the docs that I've interviewed on my Overcoming Chronic Illness podcast, including Dr. Jill Krista, and I don't want to misspeak, so I've got some other names that I'm thinking, but I can't remember exactly who talked about what binders, but folks, other experts out there in the mold illness world have talked about how like the type of binder isn't necessarily like, there are some binders that definitely fit better for other patients, like some patients feel better on some versus others, some don't tolerate some binders. I have some patients who get really constipated on charcoal, but they do just great with bentonite clay, sometimes vice versa. But generally, there seems to be quite a bit of flexibility or fluidity in terms of what binders are going to work for patients in general, but there are, of course, exceptions to everything, including that statement. As far as, will cholestyramine help to heal a leaky gut? I'm not aware of any mechanism of action by which that would likely happen, except that some mycotoxins are very toxic to the gut. They're very irritating to the gut lining, the intestinal lining. And so if a patient had leaky gut due to mold, then the sequestration of those mycotoxins could create an environment where the intestinal tract could heal. So except in that very like nuanced state, there's no, to my knowledge at least, no leaky gut healing properties of cholestyramine in and of itself. If you don't mind taking a quick moment to please like, share, subscribe, and or post a quick comment on the video, I'd really appreciate it. So thanks in advance for taking a second to do that. If you have any questions on this topic or on anything else, please post it in the comment section below, and I will do my best to answer as soon as I can.